I want to give you the actual data on vitamin A and acne management because in 2022, a group did a review of all of the studies that were available online for managing acne with vitamin A. So this comes from the Dermatology Online Journal. There were 9 studies that were using vitamin A to manage acne. Some of these go back all the way to 1943. But since the development of Accutane or isotretinoin, there's been much fewer studies done on the management of acne using vitamin A because Accutane did such a better job. In all 9 studies, acne improvement was the outcome measure, but in all of the studies using vitamin A, only 2 of them mentioned complete clearance of acne. When we use an appropriate dose of Accutane to manage acne, the results of complete clearance are about 85%. The relapse rates for vitamin A management of acne were comparable to the rates of isotretinoin. So the relapse is you finished your course of Accutane or vitamin A, and when did the acne start to come back? So it ranges from about 20 to 40%. Usually, if you've completed a course of Accutane and your acne starts to come back, it's much less severe than it was before. You get mild acne back. It's not the case for everybody. It was also noted here that vitamin A, in the studies that they reviewed, were more efficacious for the treatment of facial acne as compared to truncal acne, so back acne. The data actually suggest that using vitamin A to treat acne is much better for the face than it is on the body. It just doesn't work as well on the body. Now, it's important to note that vitamin A and Accutane have also not been studied head-to-head, so we don't have a trial between those two in a double-blind placebo-controlled trial. Now, here's another important note. In the studies that they reviewed, where investigators were looking at vitamin A for the treatment of acne, the ranges that they were treating with ranged from 36,000 international units all the way up to 500,000 international units of oral vitamin A. So the lowest dose in any of these trials that was looked at was 36,000. 5 of the studies, so most of the studies, looked at a dose of 100,000 international units daily. The studies that used a higher dose, like 300,000, had a response that was considered excellent or good in 90% of patients. So that was qualified as a 50% reduction in acne. So we can see that in completing a course of Accutane, the success rate is about 85% of patients that will clear their acne. All right, let's look at safety and laboratory monitoring data when it comes to vitamin A. 6 of the 9 studies on oral vitamin A included in this review reported side effects during treatment. Wait, there are side effects? Side effects included cheilitis, so that's dry lips, xerosis, dry skin, epistaxis, nosebleeds, headaches, and abdominal pain with benign elevations in triglycerides and liver enzymes. Gee, that sounds an awful lot like the same side effects in Accutane. There are side effects that you might want to be aware of. In one clinical trial, a patient with epilepsy noted that her epilepsy worsened while receiving only 40,000 IUs daily, but resolved with the discontinuation of treatment. That seems like a pretty big deal. Don't you think that people ought to know that vitamin A might make some of their other conditions worse? Let's get to another concern of chronic vitamin A treatment, hypervitaminosis A syndrome. Vitamin A is a fat-soluble vitamin, meaning that if you consume more than your body needs, your body will store that in fat stores, and you can overdose on that. So symptoms of hypervitaminosis A include hepatosplenomegaly, that's enlargement of your liver and spleen, edema or swelling of your legs, your arms potentially, lymphadenopathy, that's swollen lymph nodes, fatigue, so you might get more tired, emotional lability, so that is where we get into potential mood swings, bone pain, muscle pain, and headache. So all of those things can happen with high-dose supplementation of vitamin A, and somebody who's particularly susceptible could experience that at even lower doses. Now, what the investigators that did this review said is that baseline and monthly pregnancy tests are also required, as in vitamin A, like isotretinoin, is teratogenic. We have the data to show that high-dose vitamin A supplementation is potentially teratogenic. Also, when talking about the half-life, when we're still on this topic of pregnancy, the half-life of vitamin A is considerably longer, around 12 days. Therefore, it may be prudent to recommend being off vitamin A as a treatment for at least 3 months before considering pregnancy. And then again, the half-life of isotretinoin is 24 to 29 hours. And so we only recommend that patients are off of it for 1 month because it's completely out of the system in reality after like 2 weeks, but a month is a much safer estimate. One benefit to taking vitamin A over Accutane is cost. Vitamin A is so much cheaper than Accutane. You're going to absorb it better if you take it with food, particularly fatty foods. Accutane is still more expensive, but if you're just taking plain vitamin A, you can get that for a lot less money. In review, be so careful when you're shopping for supplements to treat acne or really any health condition, because there's a lot of companies that make claims that don't do research, that don't provide data, and they're out there looking to make a quick buck. Let me know what you guys think about this particular supplement, and if you stayed for the whole video, thank you so much. I spent a lot of time researching this, looking for data to actually provide you with good information, and hopefully you'll make more informed consumer decisions when it comes to your own health. I'll see you guys on the next video.